Hello, my name is Diane Pagel, and I'm the Clinical Director of the Outpatient Mental Health Clinic at First Street Center, your local community mental health center. Today we invite you to learn about seasonal affective disorder. We will cover what seasonal affective disorder is, how it's related to depression, the potential causes, and what to do if you think you have seasonal affective disorder. We thought it would be a good idea for you to meet our team, so we are sharing the presentation among us. You will find First Street Center contact information at the end of the presentation. I hope you find this informative and enjoyable.
What is seasonal affective disorder? Let's take a look at the title one word at a time. Seasonal, meaning it happens at certain times of the year. In this case, most commonly in fall or winter, but occasionally could happen at other times. Affective, meaning it affects your mood, such as irritability or sadness. Disorder, meaning it affects your functioning, keeps you from doing your best on a typical daily basis. So, summarizing, it affects your mood, it affects your functioning, and is typically occurring during the fall or winter.
So what causes the condition? No one knows for sure, but we have a pretty good idea as to what contributes to the problem. A change in seasons can affect sunlight and other factors. First, a change in seasons could result in a change in our circadian rhythm. Our circadian rhythm is our sleep-wake cycle, and if this is disrupted, it affects our internal body clock, which not only affects our ability to sleep well, but may lead to depression. Second, a decrease in sunlight can lead to a reduction in serotonin. Serotonin is a brain chemical that helps to regulate our mood. When serotonin is decreased, it can also lead to depression. Third, a reduction in sunlight can also make it difficult for our bodies to manufacture melatonin. Melatonin is another chemical that helps us to regulate our mood and also helps with our sleep.
How do I know if I have seasonal affective disorder? First, let's talk about what seasonal affective disorder is not. Everyone can get tired of winter or cold weather. We can be irritated with the different things that come with this time of year, such as shoveling snow, getting up before the sun rises, or driving on slippery roads. It can be harder to exercise, and it can be difficult to connect with other people. Since some of these things can create hardships, it is normal to get momentarily frustrated or discouraged. We can miss the sunshine, or get bored, lonely, or even sad. These changes can create a temporary slump that many call the winter blues. If negative feelings or thoughts go away within a few days and do not affect your functioning very much, you probably do not have seasonal affective disorder, or SAD.
Seasonal affective disorder is a type of depression. In depression, you may experience ongoing debilitating sadness. In clinical depression, you may experience sadness or irritation most hours of the day, most days per week for at least 2 weeks. You may also experience a loss of interest or pleasure in activities, a change in appetite or eating behaviors. You may sleep too much or too little. You may feel as if you are moving too slowly or too quickly. People with depression also experience low energy and difficulties with concentration. Thoughts of worthlessness or unfounded guilt may occur. Thoughts of death or suicide may occur. If you experience these symptoms, please seek professional help.
Seasonal affective disorder is a variation of major depressive disorder. SAD can involve any of the symptoms of major depressive disorder with a few differences. First, the depression happens mostly during a specific time period or season during the year and then resolves when that time period or season is over. Sleep is affected, but usually involves sleeping too much but never feeling rested. There is often an increase in appetite and a craving for carbohydrates or starches. Some people feel more irritable instead of sad, and interpersonal problems can result from this irritability or self-isolation. Sometimes people feel as if the limbs of their body are too heavy, and a lack of motivation or a lack of future-oriented thinking is common with seasonal affective disorder.
So what happens if seasonal affective disorder goes untreated? For one thing, it can get worse or lead to a host of many other mental health or life problems. For instance, it could affect your ability to function at school or on the job. It could lead to substance abuse or severe depression and anxiety. It could also lead to suicidal thoughts or behaviors or eating disorders. It could also result in relationship problems and social withdrawal, as well as many other mental health and life problems.
So what can you do if you think you have seasonal affective disorder? First, get an evaluation by a medical or mental health professional. A visit with your primary care physician or a mental health professional will provide you with an accurate diagnosis and treatment plan. Medication management and mental health therapy can be very beneficial. Medications can restore the normal chemical balance in your brain. This is important because seasonal affective disorder and depression can change brain chemistry, resulting in depression, poor concentration, and fatigue. Individual therapy can provide you with an opportunity to obtain support, to establish coping mechanisms, and to challenge negative thinking.
So there are other things that you can do aside from medication and therapy that can be helpful with seasonal affective disorder. For example, good nutrition is important. Vitamin D3 supplements in particular have been shown to be helpful, and especially in the times when there's very little sunlight, like in our dark Minnesota winters, those have been shown to be useful for that. Also, exercise can be very important. Again, it's difficult in the winter sometimes to get out, but when you can get out in the sunshine, that's especially helpful. Otherwise, indoor exercise when it's cold, it's hard right now with COVID, but you can do things like I take yoga classes online 3 to 4 nights a week, and I have found that very helpful for my own mood. Light boxes are also shown to be effective. Not so much the LED or full spectrum light bulbs that they sell at the store, but there are light boxes specifically designed to treat seasonal affective disorder, and there is evidence that they can be helpful. There is no evidence whatsoever that lights from tanning booths and things like that are of any benefit. Sleep is also very important, so trying to stay on a schedule to the best of your ability. The more rested you are, the better you feel. And finally, connections with others is probably maybe the most important thing of all. It's really difficult right now in the time of COVID to keep those connections and maintain them as we were able back when life was more normal. But we can still connect with video chat, we can text, sending pictures, memes, whatever, just to connect and let people know that you're thinking of them and that you care, and none of us are alone right now. That's really important during this time. Be well, and this too shall pass.
We hope that you found this information to be helpful. Seasonal affective disorder is understandable and treatable. If you're experiencing any of these symptoms, please reach out to your local mental health clinic for an evaluation. First Street Center is here to help. We are located in Waconia. During the COVID-19 pandemic, we are seeing people face-to-face via telehealth. If you are seeing this video after the COVID-19 pandemic has been resolved, we'd be happy to see you in our clinic. You can call 952-442-4437 and ask for an evaluation for seasonal affective disorder. And remember, things get better.